hi everyone. So of course this is the first engagement session that we're hosting, which is being hosted by the COVID-19 support team and Bradford Teaching Hospitals. Today we're sort of coming together to look at a number of concerns that are being flagged from people within the sector, and hopefully go through some of those hesitancies towards getting a vaccine. Now, we are joined by a panel of medical professionals, and I'd certainly open the opportunity for you guys to introduce yourselves if you'd like, or if you'd like to be introduced, I can do that.
Sure, thanks. I'm John Bolton. I'm here as the medical lead for the regional vaccination program. I'm a urologist by trade, but I've learned an awful lot about vaccines in the last 6 months or so.
Excellent, thank you, John. Sharif, do you want to introduce yourself?
Hi everybody. Sharif Al-Ghazal is my name. I'm a consultant plastic surgeon. I'm also having another hat, which is the president of BAME, British Islamic Medical Association, and I'm happy to answer whatever concerns and share the others with the others people here. Thank you.
Yeah. Do you just want to tell us what BAME is in full, please, Sharif?
BAME is actually it's quite interesting because BAME is a British Islamic Medical Association, which we have over probably maybe 4,500 not only medics, nurses, dentists, pharmacists, and over the last year we've been having like a COVID team, CRG, the COVID response team, which is almost meeting on the daily basis and coordinating with many different organizations and the NHS and different NHS body. We've been initially we look after the junior medical doctors who try to fill many gaps, whether actually medical ethics, whether training them, helping with the induction, also giving them some sort of courses. We have our conference, we have a journal, but just over the last year or so, we almost 90% of our focus really on the COVID issue, because we've been really putting so much encouragement towards the BAME community, and we published the methods, which has been probably maybe we managed to collect over 35 different methods anyway. And this has been published in 14 languages. I would say the most, the subcontinent, the Middle Eastern language, as well as Eastern Europe, and the French, German, of course, as well the English language. I mean, we'll probably maybe go through some as we speak.
Yeah.
Also, I should admit, we did some statement on Ramadan, and we've been encouraging people to keep taking the vaccine, because we have many fatwas to encourage this the vaccine to carry on during Ramadan. Not only this, in fact, we had a few mosques being open like vaccination hubs to for the vaccine to take place in.
Excellent, thank you. That's very helpful, Sharif. Thank you for sharing that. Rukia, can I ask you to introduce yourself, please?
Hello, everybody. So I'm Rukia Mia. I'm currently a Deputy Associate Director of Nursing for Vaccine Delivery and Health Inequalities. I'm also a Senior Midwife. So yeah, they're the hats.
Excellent, thank you. And can I bring in David Smith?
Hi, I'm David Smith. I'm Director of Pharmacy here at Bradford.
Wonderful, thank you so much.
Responsible for setting the vaccine clinic.
And thank you, David, and great to have you on board, and thank you for giving up your time. And last but not least, can I bring in Dr. Abid Aziz, please?
Hi, I'm Abid Aziz, a consultant in respiratory medicine. So over the last year, just over a year now, we've been heavily involved with acute COVID management on Ward 31, which is one of the main COVID wards and also has the COVID high dependency unit.
Thank you for that, Abid, very helpful. Thank you very much. Over to you, Matthew.
Yeah, thank you. So just before we do sort of jump into the topics that we've got ahead of us, I would just like to offer up some ground rules. I think we're all very used to this format now, but of course, if there is a discussion ongoing, if you are okay, just to pop yourselves on mute, that would be absolutely excellent. If you have a question, you can, we are encouraging them, so please do fire away or pop them into the chat. Of course, while we are going through the information, if anything doesn't get covered, I am making a note of these for us to cover at a later date, so please don't think it's going to go amiss. But if you don't have anything straight away, we are going to start, working through a few topics that we've collated ahead of time, as I think was mentioned a little earlier. So I think, should we first check in if anyone in particular, I know Sobakay, you mentioned you've got some representatives as a part of the meeting. I don't know if you've first of all got any budding or burning questions. Otherwise, we can start running through the list we've got here.
I think we'll let you guys start first, and then as it goes on, we'll just pop in any questions that do come into mind, if that's okay.
Absolutely, that's no problem at all. Well, in that case, I know Kes also has the list. I've got the list in front of us here, but I think Sharif touched on one of them that's been quite topical at the moment, which is about, receiving the vaccine during Ramadan. We've had people, sort of coming through on duty or getting into touch wondering, is it safe for them to do so? Is it considered breaking fast? Are they okay to go ahead with getting the vaccine?
That's what I thought.
Do you want me to make a comment, actually, Matthew?
If that'd be all right, yeah, that'd be wonderful.
Yeah. I mean, to be honest, there's no issue at all from the religious side. Vaccine is permitted to be taken. It's just injection. It's nothing to do with the nutritional side. This is what there's some concerns, some religious leaders and ulama. But the vaccine itself, there's many statements being given. It's safe to be taken during Ramadan. It's permitted, and there's no problem whatsoever from this point of view. Just to make it very clear.
Can I ask something there? Because first of all, I'm not Muslim, so I'm really naive to the subtleties to this. But someone did make a point to me the other day that not so much the vaccine they were worried about, but if they felt ill after the vaccine, they would be encouraged to take paracetamol or keep well hydrated, and that was the problem for them having it during Ramadan. Does that play into it?
I mean, this is quite valid concern, actually, John. It's like any illness you get. You can always make it up after the month of Ramadan anyway, so that should be no problem at all. It's like having very bad flu. You can't just carry on fasting. Fine, fair enough. You take paracetamol, take hydration, and you carry on after Ramadan, whatever day or 2 or 3. So it's a very flexible from this point of view. I don't think there's any concern from this point of view.
Yeah. Can I just add on, John? It's Abid, hi. Hi. So if yes, people, particularly with like the AstraZeneca vaccine, people are getting quite significant side effects, headaches, etc., or body aches. And obviously, if that was to happen, then it's entirely permissible not to fast. And as Sharif has said, like if it's symptoms for 2 or 3 days, you're allowed not to fast and then just make up after the month of Ramadan. But obviously, not having the vaccine and delaying it for a month and then getting COVID is going to be much more hazardous.
Yeah, not really helpful. Thank you, colleagues.
Okay, thank you very much. Yeah, so sort of moving forward from there as well, I think another thing that's been coming up, especially more recently, with the news of sort of AstraZeneca, having that potential for blood clots, and that concern being that younger audiences may not want to opt in for the AstraZeneca or maybe advised to go for a different one. People are wanting to know a little bit more about that, whether, even simply put, are they both the risk that, both that are available, so Pfizer and AstraZeneca? Do we know more about the Moderna vaccine that's, on the way? Will that potentially have similar risks? Are we able to sort of I mean, maybe that'll be a separate thing to talk more about how that vaccine works when compared to the two that are already available. But a lot of people seem to be fairly concerned about the blood clots, and if you can offer any information on why maybe they need not worry or anything that you might have, that would be super.
I can probably pick up some of those. So there is, it seems that there is a very small risk, increased risk of getting these special type of blood clots in the brain after an AstraZeneca vaccine. And for reasons that are not clear, the association looks a little bit stronger in younger people than in older people, but commensurately, so any treatment that you give, you have to weigh up the risks against the benefits of the treatment. And the issue for younger people below the age of 30 is that their risk of having a severe illness from COVID requiring, say, ITU admission is so low that this small increased risk, fractional, tiny increased risk in blood clots is significant enough to suggest that we should probably offer a different vaccine to most people who aren't at increased risk from COVID. It is just the AstraZeneca vaccine, so we have to remember that although Pfizer is not being widely used in the UK, it was at the beginning, and it's being used in millions and millions of doses across the world, particularly in the US, and they are not seeing any association, increased association with blood clots there. And the Pfizer vaccine and the AstraZeneca vaccine are vastly different in the way that they confer immunity. Just touching on Moderna is a bit like Pfizer. So if there were a class of vaccines, Pfizer and Moderna are in the same class, and AstraZeneca is in a very different class. So there's no reason to suspect that Moderna will have the same side effect profile. If it's likely to have anything that looks like anything else, it would be like Pfizer. To put some context now, sorry, just one other thing. To put it into some context, the increased risk of getting a blood clot on your brain after a Pfizer vaccine is it's about the same risk as you being murdered in the ensuing month after having the vaccine. So it is exceedingly unlikely. It's just that your risk of having a significant consequence from a COVID illness, if you're young and fit and well, is also very low. And so the two start to become in the same order of magnitude.
Wonderful, thank you ever so much. And I can see that, Abid, do you have your hand up there? Did you want to come in?
Yes, so as John has said, the risk with AstraZeneca, they quoted it at about 5 cases of cerebral venous thrombosis per million, which is a lot lower if somebody was to get COVID. So when patients get COVID, the risk is about 39 cases per million, whereas with the AstraZeneca vaccine, it's about 5 per million, so it's 8 times less. So, if the argument is there's a risk of getting the clots with the AstraZeneca vaccine, then people have to bear in mind not having the vaccine puts them at risk of getting COVID, and the risk is a lot higher. It's about 8 times higher. So obviously it would be wise just to go ahead and get the vaccine. Obviously, if people do have concerns, there's been this adverse publicity, then there are options to go. In the UK, there's an option to go for the Pfizer vaccine. So there are alternatives, but the incidence is extremely low and the benefits far outweigh the risk. There's absolutely no doubt. You don't want to get COVID or a cerebral venous sinus thrombosis or a pulmonary embolism or stroke or myocardial infarction or long COVID symptoms.
Thanks ever so much, and back over to yourself, John. I see your hands up there. Thank you.
Yeah, it's just to clarify the logistics of the local vaccine program right now is such that we aren't able to give out Pfizer doses to people who are under 30 at present. So right now, just right now, the choice would be either AstraZeneca or waiting until we get some Moderna into the region. That will probably be a matter of weeks. They've already had some delivered to Leeds, I understand. So we will be maybe soon afterwards.
Okay, thank you ever so much, guys.
Ask a question if it's okay.
Yeah, go for it.
There's a couple of questions actually. I'll just touch upon the first one. So are people still required to have a vaccine even after they've been diagnosed with COVID? And if so, then how effective is it?
So the advice is yes, because we know that the antibody response to a COVID infection is variable. So there is a concern that that people could be reinfected, and it, in fact, there are cases where that appears to be exactly what's happened. In terms of the effectiveness of the vaccine after COVID infection, it's difficult to give you data because that's not been studied yet. In terms of people who have been proven to be infected with COVID and then gone on to have the vaccine and then gone on to have a period of observation afterwards to see how effective it is. But in most cases of vaccination after wild type infection, your immune response to the vaccination is improved. It's better than if you hadn't had it. It's almost like the COVID infection may prime your immune system, and then the second vaccination becomes even more effective. It could come to pass in a related theme that we end up having booster vaccinations as time goes on. There are talks nationally about possibly having another booster associated with our winter flu campaign, and that is again because the immune response to COVID vaccination may not be lifelong, at least in some people, and repeated vaccination or repeated inoculation, even with wild-type COVID virus, may improve your immunity over time. Sorry, long answer to a simple question.
Thank you for that. Am I okay to ask the next question? Yeah. Next question is, how safe is it to combine vaccinations?
Okay, I can pick those up again. There's no safety concern at present, and we have both done that inadvertently on occasion when there were errors in recording which one people had, but more significantly, we've deliberately done it in some individuals who have had an adverse reaction to one, say, Pfizer vaccine, and the next time we gave them AstraZeneca. So we've done it on purpose in some cases. The other thing is, and this is, again, it's difficult to be categorical about this data, but there's some evidence to suggest that using alternate vaccines may actually give a better response. We can't, because it's not proven, we can't advise it generally, but there was the Russian study that looked at their vaccine actually had two different types of vaccines, and the patients who got altering types of vaccine, different ones first and second, actually had a stronger immune response than those that got the identical one 2 times. So it's perfectly safe, as safe as normal, as having 2 of the same. We just haven't been able to prove that it gives the same level of immunity, but what little evidence there is out there suggests it actually could give you better immunity.
Thank you very much for that.
All right, thank you ever so much. So moving on to another topic that has been highlighted to us, particularly in maybe younger audiences, we're getting a lot of questions around fertility. So we're getting a lot of sort of female workers between the age of about 20, 30, around there, having concerns about long-term side effects that the vaccine could potentially cause, like the worry that maybe we haven't had enough time pass yet to see if it would have any impact on fertility. Would anyone be able to offer any advice on that?
Well, yeah, I mean, I can tell you that at present there's no evidence that it affects fertility, and it almost harks back to Dr. Aziz's point. If you're worried about the vaccine affecting fertility, then if it did, COVID would as well, and probably more so because of the widespread inflammatory response you get to it. But actually underpinning that, there is no evidence. I actually don't know where that sort of rumor came from. It's widely prevalent. Lots of people are concerned about it. But I don't know how it's got linked to this vaccine, because there was no evidence for that in any of the trials, and the trials did include young women, not pregnant women though. So what it is true to say is that there's not a body of evidence to show whether giving the vaccine whilst you're pregnant could be a problem. We have actually done it, and the advice is that we should for people who are at increased risk, because getting COVID while you're pregnant would almost certainly be worse. But within the trials that proved the safety of the medications, there were potentially fertile women in that group, and there have been no reported effects on fertility. Nor is there any logical reason why it should.
Lovely, thank you. And thank you for touching on pregnancy, just because that has been another thing people have been interested in. I suppose just to confirm there, if someone was pregnant but still interested in getting the vaccine, would that be advisable?
Generally and broadly, no. We'd suggest waiting until after the pregnancy is finished, simply because there isn't good enough data now at present to say that you should go ahead and be vaccinated. However, there are exceptions to that, as I alluded to. In fact, we've deliberately vaccinated a couple of patients that we knew were pregnant. If you're at increased risk of harm from COVID, so you have underlying clinical vulnerabilities, then it may be worthwhile getting a vaccine despite being pregnant. And also, if you're at increased risk of getting COVID. So the two that I'm aware of were nurses working in high exposure areas and were keen to make sure they didn't get COVID during their pregnancy, so we vaccinated them. They're both still fine from all accounts, and the babies are developing well in utero. They've just told me they're okay. I haven't inquired too much detail. So the general advice is no, wait until the pregnancy is finished, because we don't have enough evidence yet. But what little evidence there is appears that it is safe, and we are offering it to people at increased risk. And the same goes true if you had your first dose and then got pregnant. So the good news is you'll have quite a bit of your immunity from that first dose, but we would normally advise you to complete the pregnancy and then have the second dose afterwards.
Wonderful, thank you, John. And then next sort of going there, I know you mentioned, of course, some things seem to appear as if from thin air, and we wonder where the concerns come from. I think that's been something that people are touching on a lot in Bradford, and what's happening in some cases is that people's confirmational bias is coming into it, and then when they go into social media, they find themselves following particular ways of thinking that is maybe putting them off. Some people have raised the concern that even though the information that they are getting is coming from a reliable source, they worry that maybe it's coming from an ulterior motive, like, for example, they might be being told by their managers or something like that they should get it for work reasons, because it means that they be coming into work and they feel like they'd be fine without it. Where people are doing that, I don't know whether there is much we can comment on, but if you're finding that maybe, I suppose, you are getting a bit caught up in all of these sort of these issues that are coming up and all these other stories, would you have any recommendations maybe where people should be going to if they want to get the most reliable source information if they're feeling a bit concerned? So more a question on if people are finding that there's conspiracy theories and things like that when they go onto social media, or something that does, like with fertility, there isn't actually a grand deal out there, but seems to be quite a big topic that people seem concerned about. Is there somewhere they can go to double check and fact check that information?
Yeah, the problem is, of course, that if they believe that it's a conspiracy, sending them to somewhere like the government website isn't going to, they'd say, of course they would say that. Perhaps I'd be better off deferring to colleagues on where they would advise friends and family to go.
Lovely, thank you. I can see that, Abid, you've got your hand up there.
Yes, I think the general advice would be that, there's a lot of misinformation on WhatsApp or social media, which is not validated information. And if people have doubts about the government website, then they can look at some renewable news source, for example, BBC or whatever they're happy with, and you know, there may be an opportunity to. I mean, it would be the GP surgery. Obviously, all people don't have access to a hospital specialist, but I think the government sources are reliable. If they're perhaps not happy with the UK government, they can look at, you know, the US or other European countries, what they're advising. And I think, you know, but going to social media, you know, is wrong, because there's so much nonsense on social media. And when we had, myself and Sharif had a national webinar a few weeks ago, and one expert on the panel said that, I remember, you know, when you have a heart problem or a brain problem, you want to go to a cardiologist or a neurologist. But when you've got a vaccine problem, instead of asking an expert, people are going straight to WhatsApp or Facebook or something like that. And if you ask people, you know, why don't you have the vaccine or something, I don't think people can give a valid reason, or you know, something which there's evidence behind it, because a lot of this misinformation or nonsense information comes from social media, and anybody can, you know, I could or anybody could say, look, if you have the vaccine 10 years later, you're going to get Alzheimer's dementia, and that will just spread like fire. And where did it come from? Nobody's going to confirm. And it's very easy to spread misinformation or rumors, and people tend to believe. But getting the right information across to people and making people believe that is very difficult. So the advice is government websites, or you can look at other, you know, developed country websites, or, you know, maybe a news channel of your choice.
Fantastic, thank you. I can see, Ruqayyah, you've got your hand up. Did you want to chime in?
Yeah, so that infertility concerns, we've picked up on a couple of things in the community, and it's the Central Eastern European communities where there's been some talk, and I think the language barrier possibly is a factor as well, whereby people felt that, is there a conspiracy theory about going back into some dark times in history where, you know, there was genocidal motivations? So that is feeding and going through the communities. And I know that our community and Race Equality Network are keen to do some debunking work. And it's word of mouth, isn't it? One person hears something and then it just starts to spread through the community like wildfire. And as Abid said very eloquently, it is seeking out healthcare professionals. Your pharmacists are, you know, a good source. Your family planning, as things start to open up. You've got your infertility team that, you know, for people that are in, you know, contact with them. These are the ideal people to go to, and no one will turn away. You know, leave a voicemail, whatever. The infertility team are the experts in that area to give you added reassurance. But certainly social media, you'd have to be quite savvy which ones you go into. Absolutely. I think you've covered most of it.
Excellent, thank you ever so much there. So with that being covered, I think we can move on to another topic. I mean, I don't know whether it kind of, we've sort of chimed in on it already, but we are finding that, especially when we speak to maybe provider managers, we're asking if they're noticing any particular themes, or if they are being approached by any particular members of staff with, you know, issues of their own. And a lot of the time, it's not that they're being, you know, they're not able to have those conversations anymore. People maybe are feeling comfortable saying exactly why they're not, but they are noticing particular groups. So as we commented on earlier, there was the younger folk who were worried about fertility, but also noticing that BAME communities are also hesitant. The reasoning behind that hasn't been necessarily made clear to myself. People have just been saying to us, like, they're just untrusting of the vaccination system, or some worrying that they could get COVID-19 from the vaccine itself. I don't know whether that sort of chimes in on what Ruqayyah was saying there about, you know, sort of maybe it's just from unfortunate historical, you know, events. But it seems like, especially in Bradford, BAME communities are one of those which aren't maybe getting the highest vaccine uptake. I don't know if anyone has any comments or any advice on that side of things.
Yeah, I'm happy to say something. So obviously we work in Bradford, and we've seen, you know, if you look at over the last year, the BAME population in Bradford is about 25 or 27%. But when we look on the main COVID wards, or like Ward 31, the high dependency COVID patients, probably about half of the patients on the wards have been from the BAME background. If you look at the ICU list every day, a lot of the patients are from the BAME background. And obviously, we know these people tend to have more sort of central obesity, diabetes, cardiovascular disease. And this is the group of patients which has been particularly vulnerable. Anybody can get severe COVID, but if somebody's from the non-BAME population or doesn't have obesity, diabetes, etc., they're more likely to have better outcomes or not go to ICU or not die. So we over the last year, that's what we've been seeing, that patient after patient from the BAME community and a BAME background have had severe disease and have died and have been on ICU or have been in hospital for 3 months. Today on the respiratory ward, I've seen 2 patients. One lady's been transferred to Ward 31 today. She's been in hospital for 3 months from the BAME background, and it's likely she'll be in for another few months. And I'm sure, most families or people in Bradford will have families or friends who have been severely affected by COVID and have been in hospital or who have died. So if you just look at the risk of the BAME population, people should understand. So they should be, saying that yes, we will have the vaccine. We don't care if anybody else has it, but we will have the vaccine. We're at increased risk, and I think probably the message is getting across. And initially there was a lot of reluctancy for nothing. There was no good reason. But I think one thing is, as people have had more and more vaccines, and nationally more than 30 million people have had the vaccine, and I think it's probably saying, okay, let's see if he has the vaccine, we'll wait till another family member or friend has the vaccine, and then I'll go for it. So I think it's just that hesitancy for nothing. But people, I myself have been to 1 or 2 GP surgeries in Bradford, and I did see a lot of patients who were queuing up were from the BAME population for the vaccine. So I think the message is slowly getting across, and people are understanding that it's not only in this country, but in many countries, like if you look at India, Pakistan, Bangladesh, the vaccine is now available, and people are realizing that the vaccine, is something that's going to save them, and they need to go for it.
Absolutely, thank you ever so much. And I can also see that Sharif, you've got your hand up. Did you want to come in there?
Yeah, just very quick comment, to be honest, because the figures, I believe, that toward end of March show that there's a great increase intake for the vaccine within the BAME community. I think it's probably touching like refusal touching only around 6-7%. I mean, last year was probably maybe or towards January time was probably maybe over 25-30%. So there is a great improvement anyway recently. Yes, we do understand there's a bit of reasonable general concern like safety or people asking for ingredients, but there's a lot of misunderstanding, probably maybe myths just been spreading to the social media, unfortunately. But I can see there's more and more people now getting the message and feeling that the vaccine is the way, the hope at the end of the tunnel, which is the only available hope, to be honest. Thank you.
Thanks ever so much, and that's great to hear that you are, seeing the uptake there. Now, for those who can't maybe see the chat outright, I think John, was it yourself? You've raised a good point there. That of course we do look at BAME often as one group, and I think potentially one takeaway from our end in the COVID-19 support team is when that is being brought up as a conversational point, we maybe need to look into that a little bit further and sort of ask questions if they're finding any key themes, so that we're not just looking at it as a very sort of looking at it as one thing, because it's often it is a lot more intricate. I think you're right to bring that up. And I can see here, Ruqayyah, you've got your hand up.
Yeah, so I'm glad John and you've both raised that. So there's a lot of focus from the work that I'm doing with CARES and some of my local colleagues in the community CCGs, because we absolutely need to break down the data and see whether it's behavioural or whether there's some kind of different comms that we need to do, similarly to what we're doing here, some targeted comms and targeted work and different ways of flexing the vaccinations out to those groups. And it could be a number of factors. It could be people that are unable to leave their homes. It could be pragmatic things like not being able to book online. Do we need to create drop-in centres? So even as we speak, I'm about to go and inspect our vaccination bus and make sure that that's fit for purpose to roll out. So we can take the vaccination out to those disadvantaged groups that are not able to get out for all kinds of reasons. It could be single mothers. So that's the point about the inequalities, because the data analysis will help target vaccination uptakes or the necessary comms to answer some of the hesitancy and dispel some of the myths. The other point I was going to also refer to is from some of the discussions that we've been having with colleagues is the spike in recent times and recent days. I think there's about 14 patients, isn't there, at the hospital. We're just wondering whether we've sort of reverted back to complacency again. It isn't a finger wag or blame anyone, but I think there's a sense of having been starved of contact and being locked away, whether we probably are seeing this complacency about the hands face, that space, that kind of message needs to be reinforced. And we all have a responsibility, whether healthcare professionals or in the community, to say, look, actions of one will impact on many. So it's that message that regionally we were talking at the outbreak meetings, to go back to how we were, because there is an element of complacency collectively, because we've been in it for so long, haven't we? And the 12th of this month has been a pivotal point where people are thinking, and we've been hearing it in some of the conversations that as people are coming in, the marshals have picked up on, well, that's it, lockdown's over, we're out of COVID. It's dangerous talk, but human nature being what it is, you can understand when it's coming, and we collectively need to drill those messages back to hands, face, space again.
Yeah, absolutely. Thank you ever so much for that. And I can see that Sharif, you popped your hand up.
Yeah, I'm really sorry to come back again. I mean, it's quite important to know that we are really not safe till everyone is safe. And we know what's going on in Eastern Europe. We know what's going on in India and Brazil. Traveling is going to probably maybe, I'm really hoping there will be no more waves anyway. But people think, I mean, I've heard from many people around, we had the vaccine, why do you need to worry? So just almost back to normal. I know I feel for the people, the economy, people, the schools, social and mental health lockdown. So, but I always probably maybe make this example, a vaccine very much like seatbelt. So will the seatbelt actually really stop any accident? Definitely not. And this is the vaccine the same, but the seatbelt will definitely make the accident much less damaging. And this is always the case. Will having the seatbelt means that you can drive cars over 100 miles an hour? Of course not. And the same, I mean, you have to take precautions, and the same for the vaccine. So we need to keep taking all the precautions, masking, social distancing, till we really all safe. This is the main message I really would like to put through. Thank you.
Yeah, and a fantastic message I think you might have caught there. I think all of us are maybe going to pinch that one, because that was a great analogy that you put forward there. So thank you ever so much for that contribution. So at least the final point from my end, we've had some we've had some contact from, again, it's sort of younger audiences. So, of course, we're at a time now where people from the ages of 45 and up can be vaccinated. And for a lot of people, it's going well, but we're finding that the younger audiences are still coming to us and saying that they feel because they're at a lower risk, it's not worthwhile, or they don't see any reason to, or even that they feel confident that they'd be able to fight off COVID, so it's not worth getting it. Can I ask if anybody would be able to have a quick word on that, please?
Yes, I'm happy to say a few words. So, again, over the last year, our youngest patient has been a girl. She was 17 years old, and she had severe COVID pneumonia, ended up on ICU, was on CPAP. This was, I think, last year in April. Fortunately, she survived. We've seen patients 24 years old, 26 years old with severe COVID pneumonia. who we've had to prone and put on CPAP. Just very recently, about 3-4 weeks ago, I was on call and there was a 22-year-old male patient from the BAME background who was admitted, and he was not overweight. He was probably about 70 kilos, no significant comorbidities. And he got so bad, he actually surprised us because he was not only, we had to prone him, we had to give him CPAP, high flow oxygen, we had to get ICU. And it was to the point we were just scratching our heads, why has he got severe COVID? Now, we had to call his parents and we were worried he would end up being intubated. Fortunately, after a few days, he turned the corner. And what we have to remember is it's yes, people who are above the age of 60 or comorbidities, they're likely to die. But the younger patients who have no comorbidities, people in the 20s and 30s, are getting severe COVID. And if they're not dying, they're certainly getting symptoms afterwards, including symptoms, long COVID symptoms. And a lot of our GP referrals that are coming now in respiratory medicine are saying this patient is 35 years old. She had COVID back in November last year. She's still symptomatic. And most of the referrals we're getting for long COVID are patients who are like young and middle age, below the age of 50. So being young doesn't mean that you're safe from the disease. And you know, our own, we have some very close family friends, and they have friends in Nottingham, and they went to Pakistan recently, and their 19-year-old son, on the way back, he was tested positive for COVID. He couldn't get on the flight, and he died last week, and he was fit and well. So young people are dying as well. Young people are getting severely affected. So this is a myth that young people are safe.
Thank you very much for that. And I can see John's put his hand up there.
Yeah, I put something in the chat, but I thought either it's true, in which case we should make the point, or it's false, in which case we should clear it up that it isn't. Abid, didn't we have a 17-year-old die in ICU of COVID about 3 months back?
I don't know if I'm not aware of the case, John, but I know there was a girl who was 17 and she survived, but this was about a year ago.
Okay, so just ignore my comment then, because I can't substantiate it. I'm not sure if it's true.
I can say that one of our patients, very sadly admitted recently, she was a lady in her she was 50 years old. This was again about 4 weeks ago, and she got COVID. Her husband got COVID. Both were on the ward. They were discharged, but their 16-year-old son died from COVID. He did have some special needs. You know, but he wasn't overweight or anything, and he died from COVID. He was 16. He died on I believe it was the pediatric ward at BRI.
Yeah, that might be the one I was thinking of, actually.
Yeah, okay. This was about probably, I think, John, it was about maybe 5 or 6 weeks ago, something like that.
Yeah, that could be the one. Okay.
Okay, thank you. And I think particularly in at least the line of work that I'm in, because we're working very closely with care settings, we're finding that, you know, often we're getting our stats back where 100% of the residents, you know, have had their vaccines, be it the first dose and they're on the way to the second, or they've had both, but we're getting much lower sort of percentages across the staff. And I think when we sort of raised that and had Q&A sessions, we've had folk obviously look at it to talk about how, you know, they feel confident in themselves. And of course, we've just made the point that, you know, it doesn't mean that you're immune to COVID just because you're young. But of course, it takes a moment to just also consider those who are around you. And of course, if you're working in a setting with elderly people, transmission is still possible. Now, that's been a point of its own where people have said, well, you know, if transmission is still possible, why should I bother getting the vaccine? And I know it's one of those where you sort of, yeah, we hope it's because we're all in this together, but I don't know if anyone would have advice for folk like that. I know in the last Q&A, someone was saying that it seems just ultimately a losing battle in their opinion. Does anyone have any thought on that?
Yes, what I would say, Matthew, is if, yes, the vaccine obviously protects you from the virus. If somebody has had the vaccine, they can still get the virus. Either they won't get COVID disease, or if they get it, they'll get mild disease. Now, I'm pretty sure the AstraZeneca data that came from the US when it was trialed in the US. This was a good few weeks back. I think it was about February or January when the data was published. And they said that anybody who had the vaccine, nobody died or became seriously ill. So yes, people, once you've had the vaccine, either you won't get COVID, or if you do get COVID, you're not going to die from it or get seriously ill. So I think it will just be a mild viral illness, or people will be asymptomatic.
Yeah, that's right. The AstraZeneca data from the US had no hospitalizations in the treatment arm, whereas they had, I think, 9 in the non-treatment arm. So there was several thousand in each arm. So it does appear that although it, as Dr. Aziz correctly points out, it doesn't stop you getting the virus necessarily, but it does seem to stop you dying from it. It's pretty effective at that, actually. So.
Thank you ever so much. So sorry, I don't know if it's just a lingering hand there, or if you wanted to just come in again, Abid.
Sorry, I'll lower the hand. Sorry.
That's quite all right.
Sorry.
No, it's okay. Ruqayyah, did you want to have a quick word?
I'll put mine up as Abid drops his. So came across a group of BAME, for want of a better word, group that believed that certainly reliant on their natural immune system, and it was a mixture because this particular community, and I don't want to label them, I know who they are, that they felt that they hadn't seen any cases of COVID cases where anyone had been affected. Certainly no one had passed away, luckily. So that was a message, because we, I think the Wrens were trying to get recruit one of those community members as an entree to do some work with them, and that was the message back, to say that, well, we've not seen any cases. We're heavily reliant on natural immunity and look at taking care of one's health. So what possible reason would I have to say to the community, look, you are at risk? So it's that kind of, because you haven't been touched, which is great, it doesn't mean that you wouldn't be. And that's something that people are relying on. And again, that's dangerous. And, it's those conversations, isn't it, to say, yes, it's great. And, we're really thankful that you've been safe for as long as you have. But that is not a guarantee. And it's not going to stop you from, coming into contact and potentially having fatally, affected. But that certainly is a pattern, because it's that word of mouth. It's what people see. Seeing is believing, isn't it? The proof is there in front of their eyes. So therefore, why would they go and have this injection that they still have some concerns around, sadly?
Thank you. Yeah, I think that's fired a few hands going up there. I do apologise, I didn't quite catch the order of them. Whoever would like to, should we start with John?
Very briefly, Ruqayyah's hit the nail on the head, and there's evidence for it. So I don't know if you cast your mind back to when the wave was down in Kent and tearing through London. The reason why it was so bad there is because they'd had so few cases in the first wave. So the number of people still susceptible to become infected was very low. So in fact, if you're surrounded by people who've never had COVID, you're actually at probably a higher risk than if you're in a group of people who've all been exposed to it already.
Thank you. And David, did you want to come in?
Yeah, I suppose you could link it back to the earlier comment about the seatbelt. I've never had a car crash, but I always put a seatbelt on. My son, he's passed his driving test. He's had a car crash. He's enjoyed the seatbelt. So it's back to that.
Yep, really good point there. And then last but not least, Abid, did you want to comment?
I think it's about this immunity. So some people have said to me that we've got a good immune system, so we're protected. And what we've seen in COVID, this disease behaves in the entirely opposite manner. So what we've seen again, when male patients are at particularly increased risk of dying or getting severe COVID pneumonia compared to females, and fit and healthy males are at a very increased risk. And if anything, the people who have a good and strong immune system, these are the people who end up having like the hyperinflammation response and cytokine storm, and they have very high levels of various interleukins, and they then get end organ damage and die. And what we have also seen is the people who are not as robust and the people who have been immunosuppressed, because we've seen lots of patients coming on the COVID wards who have been on immunosuppressants, and very few of those people have died. So yes, having a strong immune system is generally good, considered good, but when it comes to COVID, it's not particularly good for COVID because you're at risk of getting the cytokine storm and dying. And so sometimes it's better probably to have a lower level of immunity and not having this hyperinflammation response.
Thank you.
Yeah, that's the first thing you do, isn't it, Dr. Aziz? If you get admitted and you have severe COVID, one of the first things you do is give steroids to try and suppress the immune system, isn't it?
Yes, absolutely. We're giving dexamethasone. Anybody who's on oxygen therapy, non-invasive ventilation, they're getting dexamethasone, 6 milligrams a day for up to 10 days. And then about 2 months ago, tocilizumab, the interleukin-6 inhibitor, the recovery trial, the arm in which they used tocilizumab, that showed it was the second treatment in addition to steroids in helping to reduce mortality. So what we're doing is we're suppressing people's immunity because having too strong of an immune response is damaging the patient's own body.
Yeah, so it would be a false belief that having a good immune system keeps you safe.
Yes, I've spoken to people overseas and they said that it's not going to affect us because the countries we live in, there's plenty of bacteria, etc. So we're exposed and we've got a good immune system. But they don't understand that's got nothing to do with COVID.
Thank you. And I can see, Sharif, you've popped your hand up.
Yeah, just very, very quick point, actually, because we're forgetting about the long COVID as well. It's not a matter of just having COVID and you've got great immune system. I mean, I've got a close friend of mine, he's a consultant pharmacist. Probably maybe Dave might know him. Definitely Abid, he would know him because he was his patient in St. James. He's still, since November, he's still now in the hospital in Leeds. And he's only 40, early 40. So it's a really very nasty disease. I mean, long COVID with all the complications. I think people as well, they are not putting this in the context, unfortunately, when they think, okay, why do I need to worry? I mean, it's just like another flu. Like it's a quite nasty disease, unfortunately.
I would like to make one point that when COVID started about a year ago, we said, okay, maybe it's better you just get COVID and you're over and done with it. But we have to remember people who have suffered severe lung damage from COVID, God forbid, if they survive the first time, I don't think they'll survive the second time because they've got absolutely no reserve left. And, when they come to our long COVID clinic a few months later, about half of the patients are on oxygen. So imagine that patient getting COVID again after 9 months or 12 months. I don't think they've got a chance to survive. So because this is not a disease that has just, it's not a 1-year illness. We don't know if it's going to end if it does.
Thank you.
Sorry, I think I'd like to add that the symptoms of long COVID are quite interesting. So, I mean, I had COVID a year ago, and while I can now taste and I can now smell, it's not the same again. So some of my favourite foods I no longer enjoy. So I was lucky I had symptoms for a week, I recovered. But to be honest, I haven't had a decent curry since because the taste buds have gone. So that is a long symptom for me. The consultant pharmacist we're referring to spent all of Christmas unconscious. His wife and children came in, I think it was at least 3 times to say goodbye. He's 44. He's lost a third of his body weight. I still don't think he can walk because he was under for that long. So it's affecting young people. And while you may just think you may just squash it off, stop it. You can no longer enjoy your favourite food. Maybe a minor thing, but actually it can be quite a major thing as well.
Yeah. And David, the person you're speaking about, because I looked after him back in November for 1 week on the ward, and it was so emotionally draining and disturbing because he was saying, do something for me saved me. I've got 4 children. So it's not only the patient or the family, but it has a massive impact on the healthcare professionals. We try not to have that sort of emotional attachment, otherwise we can't do our work, but sometimes you just can't help it. And it was very distressing to see him.
Of course, thank you. No, I'm totally aware of the time that's passed by as we go, and unfortunately I think we've managed to get through at least my list. I don't know if Kez has noticed anything that's maybe been missed off while we've just got everyone here, but as we come to the end of the session, I did firstly just want to pass on a huge thank you for everyone's time, coming across and offering your advice. I think it's going to have created a really useful resource. Of course we have recorded this, so if you'd like a copy, do shout out. And I would like to remind everyone that we are also going to be organising some peer engagement sessions where people from, other care settings who've maybe gone for a vaccine, who were previously hesitant, can have a conversation with you. So if you feel like something's not been covered or you still have any burning questions, please do get in touch with us. You can get in touch with the COVID support team, and I'll just pop the email address into the chat. And of course, I would also encourage you to bob onto the chat when you get a chance, because all throughout this conversation there's been some really useful things going in there as well. But from me, I'd just like to say an absolutely massive thank you to you all. It's been really helpful to hear firsthand, and as well is going to be a great help in my job. So thank you.